Well, NEHAWU strike is putting ICU patients' lives at risk, and that's according to the Critical Care Society of Southern Africa. It's calling on the union to end the week-long wage strike, and it says that the strike goes against the principles of the healthcare profession. So let's get more of the society's president, Fathima Paruk, joining me this morning to take our conversation forward. And Fathima, thank you so much for your time. Good morning to you. Quite concerned you are, I understand, as the Critical Care Society of Southern Africa on the impact of this union on patients currently in ICU. I mean, how severe is that impact?
Good morning, Tumelo, and thank you for having me. So in terms of the quantification of that impact, it's really too early to say. Usually during a crisis, it's extremely difficult to gauge that, and the true impact will obviously emerge once the crisis is resolved. But what I can say is that based on the reports that are emanating from around the country, it's clearly obvious that it's impacting particularly on patients in terms of access to healthcare. There's disruptions to services, and even healthcare workers are being impacted. And as a society, we are deeply concerned about this, including the reports that relate to the loss of lives.
Have you had an opportunity to perhaps engage with NEHAWU in terms of further, intensifying your call for the strike action to end?
Tumelo, this crisis emerges from a wage conflict, and this really falls out of the ambit of the organization, the Critical Care Society. And as such, what we have done is release this statement to say that let's put a pause to the strike, because what we're doing now in terms of the methodology that is being used to address this, it's really not working. The impact is just too negative, and really we need to seek out an alternative strategy to resolve the wage conflict.
Yeah. Have you heard from hospitals, Fathima, healthcare facilities in terms of healthcare workers either intimidated or stopped from going to work, exercising their right to go to work?
Currently, everyone is largely very busy. We're under pressure. Resources are being eroded. And as such, what we're largely relying on are the reports from the media. And that in itself is clearly indicative of what's happening at ground level around the country.
So what's your call and your appeal this morning, Fathima, to NEHAWU leaders? Should they be watching our conversation this morning as the Critical Care Society of Southern Africa? What would your call to them be?
Our plea is that let's stop the strike action immediately. Let's let the necessary organizations and structures engage to resolve this conflict in a manner that does not cause further suffering and loss of life. Ultimately, our patients have a right to health, access of health, patients' dignity, and our healthcare workers also need to be protected. And our call is really that the suffering has to stop.
Is that why you also say that the protesting workers' actions are against the principles of healthcare professions?
It's our constitutional right for all our citizens to have access to health care, to have dignity in the workplace, and for healthcare workers also to have dignity in the workplace. And right now, that is not being upheld.
All right. Well, of course, we have to leave it there, but I appreciate you adding your voice to this and talking to me this morning. Fathima Paruk, the president of the Critical Care Society of Southern Africa.